Our second segment of the program this morning features Dr. Kavanagh. He is a retired physician, founder of an organization called Health Watch USA. Good morning to you, sir.
Good morning, Jack.
Did you watch any of the debate last night?
I did, and it was an actual debate as opposed to well, I don't know what to describe the first one, but it wasn't pleasant to watch.
A debacle, I think.
Yes.
We have said over and over again, and I believe this to be true, in most cases, the truth lies somewhere in the middle. And I always believe that, and I think they proved last night when they discussed COVID-19. The reality is, as the president says, we shut the country down. If we do that again, we're not going to have any country to shut down. And on the other side of the coin, if we get into a situation where we have to start shutting things down, it really won't matter because everybody's going to be dead. So those are the two extremes, and I felt like they were kind of represented last night. How do we strike a happy medium, I guess?
Well, Jack, for me, it's opening up safely. And that is wearing masks and wearing them properly with a well-constructed cotton mask, doing hand hygiene, having proper ventilation in facilities, and social distancing. And I was very pleased that they did talk about schools, and Vice President Biden stated that they needed to upgrade ventilation systems, and he talked about smaller class sizes, pods, along with rapid testing. So I do think that there is a way of opening back our economy, but it's not going back to the normal. We're going to have to make some changes in order to do this safely. And once we do this, I think we can get back to a near normal as far as life goes. But I, for one, want to be able to go into a retail establishment and know that people are wearing their masks. And what I mean by wearing the masks is that's wearing them properly. Too many people have their nose sticking out or the mask is hanging off the side. That doesn't help much. We need to really embrace these public health strategies because in Kentucky, as you know, things are not going well right now.
Another bone of contention as it relates to COVID-19 at the debate last night was when the vaccine is going to be generally ready for the public. The president says in a few weeks, certainly before the first of the year. Mr. Biden says once it's distributed and generally ready for consumption by the majority of the country, it's going to be more like the middle of the year next year.
Well, I would go more with Vice President Biden's prediction. But President Trump is correct when he says we will have a vaccine or a probability of having a vaccine by the end of the year. It will just be available to those at highest risk or healthcare workers. It won't be available to the general public because there just won't be enough doses. Also, the first ones coming out of the gate, that of Pfizer and Moderna, those vaccines, they are problematic as far as distribution. They have to be kept at ultra cold temperatures between minus 70 to minus 100 degrees zero from point of manufacture to when they're given to the patient. And they also require 2 doses. So you may have 50 million doses to give, but that's only 25 million people. But that's a tenth of the population. That can get a lot of the frontline workers along with a lot of people who are high risk. However, that's assuming the data from these vaccines support the awarding of an emergency use authorization. So we'll just have to wait and see what happens.
Now, we also heard yesterday that, is it remdesivir that's been approved?
Yes, and I think that that's really, as I said, maybe a modicum of benefit to the patient. The approval was based on shortening hospitalizations. It was not based on preventing hospitalizations or preventing deaths, which of course are 2 of the biggest items that I think many patients would like to have happen. And as you know, if you are hospitalized, your chances of getting prolonged disability from COVID-19 goes up exponentially. So it has been approved, but it is not really a cure-all drug. It's more one that will provide some benefit.
What is the big to-do today, the big vaccine meeting?
Well, that was actually yesterday, and I was hoping
Oh,
it would give us some data on the efficacy of these vaccines, but it unfortunately didn't. It went through the approval process and what they're going to be looking for. And there were a number of concerns by a number of the public commenters, which were actually scientists from universities and also prominent people from public health advocacy organizations. From what I could tell, and I'm just going to summarize this fairly quickly, is that the vaccine safety will probably be fairly good. They're going to look at 2 months worth of safety data, but that isn't the normal 6 months or greater data, but the vast majority of complications and adverse events occur within the first 2 months. Efficacy, however, is a little bit more concerning because if you only follow a vaccine for 2 months, you're not sure how long it's going to last. There's also problems with what they're looking at as far as saying it's effective. That is, that it prevents COVID-19, which could be preventing a cough. In other words, it could be kind of like remdesivir. It helps, but it doesn't prevent deaths or hospitalizations. So this is something that really, I think, needs to be looked at further. But if you're a patient and you're high risk, there's little downside of getting this vaccine compared to what it would be to get COVID. I believe, and this is just my personal opinion, that risk versus benefits, if you're high risk, would be to get the vaccine. If you're low risk, this probably isn't going to be available to you to mid next year. And by that time, there'll be a lot more data available about the vaccine's safety and effectiveness.
going back to the debate last night, because I think it's very important for voters to sort of have a handle on where the candidates stand regarding this very important subject, COVID-19. And I still got the impression that the president thinks that it's going to go away. Did you get that sense?
Well, I did. He was really against at one point opening without restrictions. That was my feeling. And you can't open safely unless you have some restrictions, such as wearing masks, social distancing, redoing ventilation systems, getting the airflow safe. That's of utmost importance. And I do believe that's going to be expensive for businesses, but this would be a good area for the federal government to invest their money to not only help businesses, but stimulate the economy. The president did state, and he stated this twice, that the N1H1 was far less lethal than COVID-19. So I think that's an admission, again, similar to the Bob Woodward interview, that this type of infection that we're currently having is very serious. It's very lethal compared to the flu, and we really do need to take it seriously and adopt public health measures.
I read yesterday that there was a death involved. I think it was the AstraZeneca product, and one of the people that was taking that, either that or the sugar pill, but that's going to have to be investigated. Is that going to be a big setback?
Well, I think it will be a setback if it's in the experimental group. But you need to remember that when you're dealing with a very, very deadly pandemic, especially if you're high risk, you can have a vaccine that has some side effects. And if you're high risk for the pandemic and it's widespread, you may still want to take the vaccine. So vaccines take some time to develop. On average, it takes 30 months to do a phase 2 trial, 30 months to do a phase 3 trial. And what we're doing is compressing this development evaluation into something that is a little under a year. And that is phenomenal. They are doing it as safe as they can do it. But for those of you that are on the front line, or if you're very high risk for this, or you, like myself, really want to see your grandchildren and have risk factors, a vaccine is something that you need to seriously consider and certainly weigh the risks versus benefits.
The president also made reference to distribution once the vaccine or whichever vaccine is available and cleared. Distribution will be done by the armed services. Are you familiar with that?
Well, it can be problematic. There were several mechanisms of distribution that were mentioned at yesterday's meeting. Pharmacists, for example, were certainly mentioned and they were top on the list. You could do it through armed forces to get these to the frontline providers, whether it's a physician or a pharmacist. The vaccines which require an ultra-cool temperature, they were stating, would be distributed in a cold container to then be taken out and used. Now, when you say minus 100 degrees, a lot of people, I think, would be frightened of that. And believe me, it is concerning, but that's essentially dry ice. That's about minus 100 degrees Fahrenheit. So I imagine they'll come in a dry ice type of a thermostat and will have to then be used within a couple of days. Still problematic over a vaccine that you can just remove out of your refrigerator, but you can certainly overcome those type of barriers. The other big problem with these vaccines is that they require 2 doses, and there'll be multiple vaccines out at the same time. So the patient has to be sure that they get the same vaccine for the second dose that they got for the first dose, or they won't work. So one of the things that is going to happen is that the patient will be given a card at the time the first dose is given, so they can make sure if they go back to another provider that they will get the same type of vaccine. Because you can't get 1 dose of one vaccine and then another dose of another type of vaccine. That probably won't work.
Yeah, I was going to say they just wouldn't work in contrast to the other. Could you actually hurt yourself doing that?
I don't think you could necessarily hurt yourself, but you're not going to achieve the level of immunity. Remember, this virus doesn't create a huge response in a person once you get an infection. Many times, if you're asymptomatic, the antibodies aren't lasting. So a vaccine, in order to make it work, sometimes need to either have an adjuvant or it needs to be given in 2 doses. And when you do that, you will create an immune response that's hopefully greater than what you would get with the infection.
Are we in the second wave at this point in this country?
Well, I think we are, or you could say the third bump or whatever. We're definitely in a time of escalation. Although we've shifted geographical areas, we're also seeing areas such as Kentucky, and you're seeing some resurgence in New York City that the viruses and cases are going up. And this is not only the cases, but also hospitalizations and deaths are also starting to rise. So this is truly a resurgence, and it's something we need to do to say, hey, we have to follow public health measures, and we'll try to get this quieted back down. As you know, Jack, the CDC did a recent study that showed, as of October 3rd, 300,000 excess deaths in the United States. And of those, the CDC was able to document almost 200,000 being related to COVID-19. Other tracking agencies have that number higher, but nevertheless, this is causing a lot of deaths. And when you look at this and you have the knowledge that public health measures alone could quell this epidemic, this really does reinforce the need for the public to wear masks and social distance.
All right. Thank you, Dr. Kavanagh.